Welcome to our instruction for the laser therapy devices HILARIS FL and HILARIS HAEMO. Note, please read the operating manual before using the laser device for the first time. The laser device is a modular system and consists of the following parts, depending on the version. Operating unit, HILARIS control, surface irradiation adapter, HILARIS FL red or FL blue, blood irradiation adapter, HILARIS HAEMO red or HAEMO blue, articulated arm, laser protection goggles, power cord and connection cable, accessory bag with mounting material. Note: laser class 2. In case of glare or irradiation of the face, suitable protection goggles have to be used. The HILARIS FL area laser is delivered with a power supply unit on the equipment cart. A mobile trolley is available for mobile use. Assembly of HILARIS control with extension of HILARIS FL or HAEMO on the equipment cart. Place the control unit on the equipment cart and align it at the front edge. Secure it with the 2 supplied screws. Place a lock washer on each screw and tighten them into place from below by using the larger pin wrench. Now install the articulated arm. Insert the plastic washer into the opening. Unscrew the star knob until the bolt of the articulated arm can be inserted. The articulated arm can be swung out by slight opening of the 2 black toggle handles, that the laser head can be mounted. After the swinging out, tighten the toggle handles again. Note: to prevent the articulated arm from dropping down on the patient, both toggle handles always have to point to the left from the front view. This prevents the joints from releasing on their own. The Heltschl logo has to be readable and should not be upside down. Press the lock slide on the ball joint head and fully insert the surface irradiation adapter. Release the lock slide and check if the surface irradiation adapter is engaged. The lock slide should point upwards. Tighten the previously loosened Allen screw with the smaller pin wrench. If the surface irradiation adapter loosens during operation, retighten the Allen screw. The plug of the connecting cable has to be inserted so that the red dot on the plug shows to the marked point on the surface irradiation adapter. The surface irradiation adapter can only be plugged into the FL position on the control unit. Pay attention to the point-to-point alignment. Fix the cable clamps at the articulated arm to prevent the cable from hanging down on the patient. The blood irradiation adapter can only be plugged into the HAEMO 1 or HAEMO 2 position on the control unit. Pay attention to the point-to-point alignment here too. Plug the power cord into the power supply unit and press the cable clamp firmly on the plug. If it's necessary, use flat nose pliers or combination pliers. Don't damage the cable. Insert the plug of the power supply unit into the back of the control unit. The flattened side needs to face upwards. Note: for the mobile version in the trolley, the articulated arm has to be fixed on a stable table by using the supplied table clamp. If the control unit is used as a mobile version, 4 rubber feet need to be screwed on the underside. Before starting the control unit, all cables and adapters have to be connected and the device has to be provided with power. Press the main switch on the back of the control unit to start the device. Note: if a treatment adapter is connected after you switch on the device, it will not be recognized. In this case, the control unit has to be restarted. After you switch on the device, the display shows you which adapters are connected. The display changes to the main menu setting. All connected adapters are displayed via a separate button. Touch the button for the desired adapter. It will be highlighted in color and you can set the irradiation time. There are 2 input modes for the area laser. Option 1: Manual setting. via the plus-minus time buttons next to the irradiation time window. If a 1000 milliwatt surface irradiation adapter is connected, two buttons appear on the display, 500 and 1000. If it's necessary, the power can be reduced, for example, for children. Note: for the haemo-laser therapy, only this setting is available. Option 2. Indication selection and calculation menu. Via the indication selection, hook button on the main display. There are 4 specialist areas with subordinate indications to choose. If the indication is selected, a green arrow appears next to it. Pressing the Enter button will lead you to the calculation menu, where you can adjust the dose and power again, for example, for children. Press the Enter button and you will get to the main menu. Press it again and the laser ready mode is activated. The ring around the Start-Stop button will now light up blue. The area laser and blood irradiation adapters can be started one after the other and used simultaneously. The therapy will be started by pressing the Start-Stop button. Note: only one surface irradiation adapter and one blood irradiation adapter can be used at one person at the same time. During treatment, the ring lights up green. The remaining time shows up on the display. Treatment can be interrupted and continued at any time by pressing the Start-Stop button. The remaining time will be saved. Attention! If the backspace button is pressed during therapy, all adapters are turned off immediately. The therapy times reset and the device switches to the main menu. After the time has elapsed for all active adapters, the device switches off automatically and returns to the main menu. The gear icon takes you to the basic settings, where the following parameters can be permanently pre-adjusted: the dose suggested in the calculation menu, the treatment time, and the priority of the irradiation adapters. Furthermore, all parameters can be reset to the factory settings. Press the Enter button to confirm the settings and you will return to the main menu. After leaving the basic settings, turn off the device at the main switch on the back. Start it again after 10 seconds. This saves the settings permanently. Application on the patient: area laser, HILARIS FL RED and blue. To position the surface irradiation adapter, swing out the articulated arm of the transport position. Please loosen the black toggle handles and tighten them in the desired position. Ensure that the irradiation position is as vertical as possible and at a distance of 3 centimeters to the patient. Attention! The surface irradiation adapter must not be placed directly on the skin or wounds. Danger of contamination and danger of infection. The area laser must not be adjusted directly on the eyes or near the eyes. Risk of injury. Loosen the star knob on the ball joint head and bring the surface radiation adapter into the desired position. By tightening the star knob, the surface radiation adapter remains in the desired position. Now, the therapy can be started by using the Start-Stop button. At the end of the therapy time, turn off the device at the main switch and return the articulated arm to the transport position. Application on the patient: haemo-laser, HILARIS HAEMO RED and blue. Prepare the following articles for the haemo-laser application: hand disinfectant, disinfection pads, medical waste container, a tourniquet, and a single-use optical waveguide in sterile packaging. A strip of adhesive tape is required to secure the optical waveguide after insertion into the patient. Prepare the patient on a treatment table and choose the arm where you want to insert the cannula into the forearm vein. Take the tourniquet and tighten it on the patient's upper arm. Disinfect the puncture site. Take the single-use optical waveguide out of the packaging and remove the protective cap. If the single-use optical waveguide has been contaminated, a new one must be used. Note: the protective cap must not be replaced on the cannula after therapy. Risk of injury. To avoid injuring the patient during insertion, loosen the connection between the cannula and butterfly and pull back the fiber approximately 5 mm in the cannula. Please pay attention that you won't pull out the light guide completely. Insert the cannula about 1 cm into the vein. If the green plastic part of the cannula fills with blood, connect the cannula and the butterfly. It may happen that no blood collects in the indicator. Insert the cannula obliquely into the forearm vein. To prevent the cannula from moving during therapy, fixate it on the patient's forearm with an adhesive tape. Open the tourniquet and remove it. Now, the blood irradiation adapter can be connected to the single-use optical waveguide, and the device for laser blood irradiation is ready to start. Insert the plug from the single-use optical waveguide into the provided opening on the blood irradiation adapter until you hear a click. Fixate the blood irradiation adapter on the patient's forearm. The patient should not be disturbed by any closure. It should be loose enough that no blood is blocked, but also tight enough that it cannot slip off. Ensure that the blood irradiation adapter is fixated close to the single-use optical waveguide. The components should be connected loosely and without tension. Start the haemo-laser by pressing the Start-Stop button. Make sure your patient is feeling well. Now the therapy will take the entered time. After the time has passed, the laser switches off automatically and generates a triple beep tone. Take a pair of scissors and cut the fiber from the single-use optical waveguide. Attention! Single-use product. Remove the blood irradiation adapter. Pull the plug of the single-use optical waveguide out of the blood irradiation adapter. Remove carefully the adhesive strip from the cannula. Pull the cannula out of the patient's forearm vein. Immediately put pressure on the puncture site with a swab for at least 2 minutes. Dispose of the used cannula in a medical waste container. Cleaning and disinfection. The device has to be switched off and disconnected from power source during cleaning and disinfection. No liquid may enter the device. The device may not be placed in solutions or be sterilized. The surface of the device can be cleaned dry with a disinfection wipe. Only use water or a disinfectant. This also applies to the laser protection goggles. A list of suitable disinfectants can be found in the operating manual. Contraindications: superficial irradiation. Direct irradiation of the eyes. Craniocerebral region of infants. Thyroid gland, in case of malfunction. Skin changes, for example, melanomas and moles. Lower abdomen and genital area of pregnant patients. Testicles and ovaries. Diagnosed tumors which aren't primarily treated with chemotherapy and/or radiotherapy. Contraindications: haemo-laser. Pregnant patients. Patients with active tumors or leukemia. Patients with phototoxic medication. Please note the duration of effect. And patients with certain anticoagulants. Please read our detailed list. If you have any questions about handling or application, please contact your supplier or the manufacturer. You can find the contact details in the operating manual of the laser device.